Hello friends, a lot of us have taken the COVID vaccine now, and now the question I'm being asked ever so often is, how do I know the vaccine has acted? Am I safe from COVID? Am I afforded at least some protection against COVID? So how do I know this, and do I abandon taking the COVID appropriate precautions? The answer to the first question is very simple. No, you have to still indulge in COVID appropriate behavior because as you know, no vaccine is 100% safe. However, the other question remains, how protective is the vaccine and how do you assess whether you have responded to the vaccine and what is the level of protection you have afforded by the vaccine? As you all know, these are all very new chapters in science and we don't know the perfect answer to any of these questions. But there is some way we can predict whether you have or you have not responded to the vaccine. As of now, there are two vaccines which are being given in India, and most of the people who have received both doses have either received Covishield, which is given in 95% of the people vaccinated up till now, and 5% have been given Covaxin. Now, Covaxin, as you know, prepared by Bharat Biotech and ICMR, is a whole virion inactivated vaccine, and therefore the normal antibody level, which is used to diagnose COVID infection, is good enough to know whether you have developed antibodies after Covaxin or not. However, the Serum Institute vaccine, Covishield, is not a whole virus vaccine. And therefore, many patients who have been even successfully vaccinated with Covishield will have negative antibodies when tested for anti-COVID antibodies. Because a lot of these antibodies are because they're against the whole virus and not the specific component used in the Covishield vaccine. So in Covishield, we just have neutralizing antibodies, which are antibodies to the S protein of the COVID virus. Now, this S protein is present on the surface of the COVID virus, and therefore, when we give Covishield vaccine, it is basically a chimpanzee common cold vaccine along with the S protein, which is injected in the body. So, basically, the antibodies which are produced in the body is not against the whole of COVID virus. On the contrary, it is just against the S protein. So anti-S protein antibodies are something which is you should use to diagnose immunity to the COVID infection after Covishield vaccine. Anti-spike protein antibodies. Now, various labs do this test in India, and I think everybody after 2 or 3 weeks of vaccination should do IgG anti-spike antibodies. It is I have myself done Metropolis one, which is known as COVID Protect. It's very important if you want to do antibodies after taking the complete second dose of COVID vaccine. Do the antibodies after 2 or 3 weeks after the second dose, and do the IgG anti-spike antibodies. Those are protective. Now, a protective level is above 15 in these tests, but different labs have, of course, different criteria. I'm talking about COVID Protect from Metropolis. But most people after vaccination have far higher level of antibodies. For example, COVID Protect may give you a level after 2 doses more than 200, 300, even 500 in some cases. So, are these antibodies protective? Probably not completely protective. There have been cases of COVID infections even after successful vaccination. However, most of these patients who have received 2 doses of vaccine and 15 days have elapsed since then are suffering from mild COVID infection. They do not need to be hospitalized and do not suffer death. So it's important for you to know when to do these tests, which test to do after which vaccine, and also it's important to know that just normal screening tests, the COVID antibodies which are done at any lab without specification, just the normal COVID antibodies will not or may not be positive if you have taken the Covishield vaccine. So I would like to end this by saying there is no need to do anti-COVID antibodies after 2 doses of vaccination because it's not recommended. None of these tests are standardized. But if at all you want to do these tests, you should do. If you're taken Covishield, which 95% of us have taken, you should do anti-spike antibodies so that you know, and you're not unnecessarily alarmed saying that I have no antibodies. If you do the normal test, you may have no antibodies and you may feel that you're not protected. Again, a note of caution: these tests are not standardized, and even if your antibody titer is not high, you may still be protected against COVID, because this antibody only tests the cell mediated, it's only the antibody mediated response to the COVID vaccine. There is also a very robust component of cell mediated immunity, which is determined by the T cells, which is not measured by these tests. So you may be still protected against severe COVID, even if your antibodies are not high. But if at all you want to test this is what is to be tested. If you have any questions, I will be glad to answer them. And for any such other videos which you would like to know, please drop your request in the comment box. If you have any questions, I'll be glad to answer them. So my friends, only way to defeat COVID is to get vaccinated. All of you, please get vaccinated, stay safe and maintain COVID appropriate behavior. Dr. Kaushal Chhatrapati signing off. Be safe, be healthy.